A sexual addiction is a pattern of sexual behaviors that are out of control and continue despite negative consequences. There are changes in brain chemistry that are at the core of the addiction. These changes are caused by sexual behavior and fantasizing about sex or sexual activities. Sex and the thought of sex tend to dominate the sex addict's thinking, making it difficult to work or engage in healthy personal relationships. Sex addicts gain little satisfaction from their sexual activity and form no emotional bond between them and their partners. This often leads to feelings of guilt and shame. Sexual addiction is associated with risk-taking and may involve illegal activities. However, it should be noted that sex addicts do not necessarily become sex offenders. In a sex addiction, there are no chemicals taken into the body to trigger the release of neurotransmitters in the brain. When the addict takes part in sexual activities, be it intercourse, masturbation, or watching pornography, the body naturally releases these neurotransmitters instead of them being triggered by foreign substances. They become addicted to the feeling that they get while taking part in these activities. Sex addicts have many different behaviors. Some of them are compulsive masturbation, multiple affairs, multiple anonymous sexual partners, consistent use of pornography, unsafe sex practices, phone or computer sex, prostitution or the use of prostitutes, exhibitionism, obsessive dating through personal ads, voyeurism, sexual harassment, molestation, or rape. Other behaviors include sexual addicts going to massage parlors frequently, they have sexual fantasies about fellow workers, swinging, and them having constant sexual references in conversation. There are many causes of sexual addictions. There is a genetic component, their family environment plays a role, life crisis or trauma, availability of sex, availability of sexual material, them being introduced to sex at a young age, and sometimes sex is used to medicate stress. Treatment of a sexual addiction starts with the person accepting and admitting that they have a problem. This usually happens with a significant event, such as them losing their job. Treatment consists of education, support groups and 12-step programs, one-on-ones, medications for obsessive-compulsive disorder are sometimes used, residential treatment, prescription drugs if needed for anxiety or depression, medical intention to ensure physical integrity such as STD testing, and addressing other addictions such as drug and alcohol, which may be paired with their sexual addiction. The Society for the Advancement of Sexual Health has come up with a screening test for people who are curious about sexual addictions. This test can be found at the website at the bottom of the page. The nurse's role in working with a sex addict is to identify in conjunction with the client whether a dysfunction or disorder exists and refer them to the most appropriate resource. Nurses work in a collaborative role with the client, and an assessment will indicate not the sexual addiction in its entirety, but rather a concern about the sexual behaviors. Nursing interventions may include assessing the attitude of the client and the significance to determine if or when psychotherapy is needed, encourage the client, if they have a partner, to include them, referral to supportive or group therapy, teaching preventative measures such as safe sex practices, and getting tested for STIs regularly. To conclude, sexual addictions are common and easy to hide in our society. It is treatable when the addict is committed to recovery. The goal of recovery is to be able to form healthy relationships.